So let's go over the kit from Sapian. I want to explain you each part one by one. So it arrives in a box like this that you can sterilize. On the block, there's all the tools that you need to place the post in the root. The first burr you have is a 557 to initiate the opening. And there's two drills, the same one you would use to prepare a canal for posts. So they're very tiny and sharp. So you can enlarge a canal that will allow you to use those screws. And there's different lengths. It depends of the position of the tooth, if you're in a posterior area or anterior area. And this is a handle to remove the tooth. So once you pull it, you can use this to remove the root from the post, so you can reuse the post. Of course, at one point they become bent, so you have to remove. What I suggest is to use a dental floss around the post, so if it comes out or the tooth comes out, it doesn't fly in the mouth, so you can retrieve it without danger. So now for the tools, there's two different periotome that comes with the system. These will be very important to loosen up the ligament around each root before starting to pull the root. So that will reduce the pressure on the adjacent teeth. If you don't, you're going to create a lot of pressure on the adjacent teeth and you may risk to break those teeth. So we really need to work around the root a couple of minutes to loosen up the ligament as much as possible. So there's two different kinds of periotome that are used. This is the tray. As you can see, there's a like a silicone bumper to it. So when you apply the force to the tray to lift the root, it will sit on the adjacent teeth. So there's a certain way to position the tray in the mouth. The video from the company will show you, and special ways to place the post through the tray or at the end of the tray. So the trays are placed like this on the arch, and then from there there's a lift that will apply the force to the post to pull it. So I'm going to show you the screwdriver in a minute. So the post can be placed in the tray or at the end of the tray. So there's two kinds of screwdriver. So when you want to screw the post, you can use the angle screwdriver that will allow you to go more into a molar area, or you can use a straight screwdriver that will allow you to go more in the interior. Then you release the handle and you can remove from the screwdriver. The straight one here, also you place the screw inside, you tighten it up. It will allow to give a little bit more force to the screw and the screw a little bit tighter, which is very important if you don't want the screw to come out when you try removing the root. So once the screw is placed, you place your tray, and this is the lift that you're going to use, and you're going to engage under one of the ball on the post, and you're not going to go that far. You're going to stay at the first hole in the lift. So you can use the first ball, second ball, or third ball depending on how deep you are and which tooth it is. So the force will always be applied on the tray, on the longitudinal axis of the tray, never on the lateral side. You can reinforce your tray with some bite registration material to stabilize the tray and apply the force to more teeth. It may reduce the risk of fracturing teeth. So never lateral force, always longitudinal force to spread the force to all the teeth, adjacent teeth, and make sure that the adjacent teeth are strong enough. If there's decay or if there's unsupported cusp, they will break. So once your tray is very stable, you can decide which post you're going to use depending on how long you need to stick out of the tray.